Hello everyone. In this lecture, we will talk about axis determination. It is one of the important question that they can ask in your PLAB one, and they have asked it previously. So to find out axis from an ECG given, so we need to look at two leads. That is lead one and lead AVF foot. Now, as you all know, this is the QRS complex. In this QRS complex, you know that the one that is going up in the QRS complex, this is R wave, and this is S wave, one that is going down in the QRS complex. Now, if you take this, the R wave is and S wave is almost both equal in length. Okay, so what we are going to do here is that we will look the QRS complex in lead 1 as well as in AVF, and then we will subtract the length of R from the depth of S. Then we will see what kind of value we are getting, whether it is positive or whether it is negative. After this, we will apply this positive and negative in a figure, in a different figure, to find out the axis. That is what we do. So before that, we should know what is normal axis, what is right axis deviation, what is left axis deviation, what is extreme axis deviation. So for that, I'm going to show you a figure now, this one. So as you can see here, this if you look at the left side, this minus 30 to 90 degree, this area, this is the normal axis. But to simplify this, we usually, for the purpose of the exam, we take 90 degree to, sorry, 0 to 90 degree as normal. So yeah, then let's take 0 to 90 degree as normal, and 0 to 270 degree as left axis deviation, and 90 to 180 is right axis deviation, and 180, between 180 and 270, this is extreme axis deviation or indeterminate axis. So as I mentioned, after finding out QRS complex in lead 1 and AVF, we do R minus S and we apply this in this figure. All right. So as this is a complicated figure, we will draw a new figure and I will show you that. A new figure here. Okay. So we have AVF. Here we have AVF, and here we have lead 1. So the concept here is that if lead 1 QRS is positive, I mean R minus S is positive, here it is R, here it is S. If this R minus S is positive, as you can see in the QRS complex I just drew here, R minus S is what? It is positive. The R S is small compared to R. So if lead 1 R minus S is positive, you need to put positive here in this quadrant that is near to lead 1. This whole half of the circle you need to put positive, that is closer to lead 1, not here, not the one that is far from lead 1. Similarly, if you take AVF here, suppose the QRS, if it is, say, it is R minus S is again positive, R is compared to R, if SS is small, if it is positive, you need to again shade this area again. The If it is positive, shade the half of the circle that is near to AVF. So here this area is positive again. All right, so from this figure it is clear for you that there is a common area that is between 0 and 90 degree. It means that the axis is between 0 and 90 degree. That means it is normal axis. So this is how we determine the axis. Find out lead 1 AVF, do R minus S and shade the half of the circle that is near to the lead if it is positive, far away from the lead if it is negative, right? So let's take a few more example and do this exercise. Let's find out axis. In this case I'm going to erase everything. Okay, now you have to tell me, take this lead 1 and take this lead AVF. What is R minus S? What is R minus S here? It's very tall. S is not even visible, so R minus S is positive. R minus S is positive means this is our circle. Okay, this is lead 1. Lead 1 R minus S positive. Lead 1 positive means half of the circle that is closer to lead 1 is positive. Now let's take AVF. This is AVF. Now let's take AVF. It is R minus S. The S is too deep compared to R. So R minus S is negative. AVF is negative. So we shade the circle, half of the circle that is far away from the AVF. So this area. So from this figure it is clear for you that which area is common. It is the area between 270 degree and 0 degree. This is which axis? This is which axis? The left upper part. This is left axis deviation. This is left axis deviation here. Left axis deviation. Well, for the purpose of exam we take 0 to 270 as left axis, 30 degree, no, at least for the purpose of the exam it is 0 to 270 is left axis. So do the R minus S in one and AVF and find out the axis. That's it. Let's do another case. Find out the axis in this case. Let's look at lead 1. Lead 1, it is very clear which is R minus S. S is not even visible here, so R minus S is positive. So let's make the circle again. R minus, this is lead 1, this is lead AVF. R minus S in lead 1 is positive, so this lead 1 R minus S positive, so half the circle closer to lead 1 is positive. So this is positive, this side is positive. Now AVF, let's look at AVF. AVF, it's clear for you that this is, or this is S. S is R minus S in this, from this figure it is negative. So negative means away from the half the circle opposite, closer to the AVF. So opposite, if this is AVF, since it is negative, half the circle away from the AVF, so this part. So this is again which axis? 0 to 270 degree. This is left axis deviation. All right, now let's look at another figure here. Okay, so if you look at lead 1 here, lead 1 R minus S is almost, I think S is a little bit tall compared to R, so R minus S here is negative. Where is lead AVF? Yes, here is AVF, and R minus S, it's very clear that R minus S is positive. Now let's draw it over this figure. Okay, so lead 1 positive and negative, so shade the side that is away from the lead 1, half the circle. Now take AVF. So AVF is positive, so yes, again shade a circle that is closer to AVF as it is positive. So from the figure, it is clear for you that which area is common. It is the area that is between 90 to 180 degree. It is called, this area is called, which this is called right axis deviation. This is called right axis deviation. You can see here. This is the right axis. Okay, now let's do one more exercise. Let me see. What is this? Well, some of you might be knowing this. This is already, those who are familiar with ECG, they know that it is a VT, ventricular tachycardia. Well, if it is ventricular tachycardia, the thing is that I don't do any calculation if it is VT. Why? All ventricular tachycardia, they their axis is extreme axis or indeterminate axis. This is the answer. It will, if it is a VT case, you don't have to do like what we have done so far, like drawing the circle or do those things. No, if it is ventricular tachycardia, yes, it is going to be indefinite axis or extreme axis. So well, in fact, in wheat it is very, it's really difficult for you to find out this QRS complex. But let's try. This is lead one. Obviously this is R wave, but here we don't know the baseline, as it is, as there is no, we can't see any PR segment here. But from the ECG, it's like you can see that this, at least it seems like this S is so tall, it's going too down. So let's take R minus S is positive, sorry, R minus S as negative. In which lead? This is lead 1. So R minus S is negative, means opposite side of this area. And let's take AVF. AVF is also like R minus S, it seems like it's going too down. So R minus S is again, it is negative. So AVF is negative R minus S. So shade this area. So which is a common area? It is the area between 180 degree and 270 degree. So this is going to be extreme axis. As I mentioned, if you know it's VT, polymorphous VT, whatever, really any type of VT, it is going to be extreme axis. You don't have to go and find out the R wave and S wave. All right, so let's do another exercise here. Okay, let's see. Okay, we have lead 1 here and QRS complex. This is R, S is really small, so R minus S is here positive in lead 1. Now let's take AVF. Where is AVF? Here. R minus S is obviously it's negative. Let us now draw it over this figure. Let's shade. Lead 1 positive, this is lead 1. Inferior, this is AVF. Lead 1 positive means shade this area half the circle closer to the lead 1. Now what about lead AVF? In AVF it is, in AVF it is negative, so AVF is negative, so shade this area. So which area is common here? It is it is the it is which area? It is left axis. It's a left upper part is the common area, so it is left axis. So I hope that it's clear for you that which part, like to find out the axis deviation if they give you any CG. And in your whatever source you are following, there are some um, examples they have given you, that is right axis, causes of right axis deviation, left axis deviation. So some of them you can like logically make why it is right axis and why it's left axis. I can show you one two examples here. So let us ask you that what will happen if it is inferior over mi. This is a figure that we are using. Okay, so in inferior or mi, the inferior part of the heart is scarred. As it is scarred, it's no longer going to conduct the electricity. So initially the vector was like this, normal axis. Since depolarization is not happening in this inferior side, this will shift a little bit up. Since this area is not active, no depolarization, the net current will move little away from the inferior side, little away from the inferior side, so it will go little up. It will go little up. So which axis is it is? It's going to lie here. So inferior wall mi will cause left axis deviation. Similarly, you can think of right bundle branch block and left bundle branch block. In case of left, let me draw this heart again here. Okay, this is a heart. In case of a left bundle branch block, what happened? This is your bundles. Okay, and it's giving, this is the AV node bundle of his, and this is giving right and left bundle, and some Purkinje fiber is there. So let us say this is the left. If this is not working, this part, okay, this is not functioning, left bundle branch block. So what happened? The depolarization will happen as usual in right part. The depolarization will happen, but since this part is not getting depolarized because of left bundle branch block, so in fact the current that has reached the right right ventricle will go and depolarizes the the left ventricle. So if you see these, you can see the current is going towards left. This is left, this is right. Okay, so left bundle branch block, the current from right ventricle will go to left side, so it is which axis deviation? It's going to be left axis deviation. Similarly, if it is right bundle branch block, then the left ventricle will usually, as usual, get depolarized, but the right part not. But the depolarization that happened at the left ventricle will go towards right. So which direction it's going? The electricity is going right direction, so it will be right axis deviation. So yes, you can logically make some explanation for the reason why some inferior wall is causing left axis deviation, why left bundle branch is causing left axis deviation, right bundle branch will cause right axis deviation. Like there are many examples, and as I mentioned, you can draw a diagram, and like you will get the logical finding, logical explanation. All right, so that's it. We have done about the axis, and in next lecture we will talk about I think we'll discuss about arrhythmias different, like atrial fibrillation, flutter, SVT, ventricular tachycardia, ventricular fibrillation. All of these are very important. It's a high yield topic, almost sure one or two questions. Okay, so see you in the next lecture.